Hello, hello, Facebook friends and family. How are you today? So, oh my gosh, it's the 10th of October. Happy World Mental Health Day. I hope that everything is going well for you. And if things aren't trotting along well, that you know where you can go and who you can reach out to for help and for support. Today, I really wanted to talk about the confusion around healthcare and around what we should do best for our health and well-being. And it seems like every week there's something new filling our social media feeds, filling our inboxes, filling the news stories all around us. There's something new about new research that shows it might do this or we may do that. Um, Lots of anecdotal stories about, well, I use these drops, or I use this method, or I use that method. I went keto, I went paleo, I went whatever. I'm vegetable based eating, and it's so confusing. How do you know what's best for you? Well, a few years ago, I stumbled across, during some networking in Canberra, I stumbled across a method of really discovering what is a manual. So I used to joke about, children don't come with a manual of, how to look after them. They actually do. Every single one of us. There are telltale signs within our bodies of what's best for us. Um, so a few years ago, as I was saying, during some networking, I came across this lady who had a system and using AI, so we input body measurements, and from that input, the AI ascertains what hormones had the most effect on our bodies as we were growing, where the energy went to what layers of the fetus, and how we evolved, how we biologically evolved, and how we came to be the people that we are today. And there are tells. So someone whose body responds to a lot of the sex hormones, testosterone and cortisol and those sort of hormones, there are ratios within the body, within bone length, within finger length, and we can tell that that's what their body's been exposed to. Through different ratios, we can tell that someone has a relatively longer digestive system, and for that digestive system, the best thing they can do is eat a plant-based diet, obviously with protein. So I'm not saying they're vegetarian. They can be vegetarian if they wish, um, but mainly lots of plants to help create health within the digestive tract, and so their body can generate the serotonin it needs to be happy and to facilitate the people that they are. We know that other bodies are very responsive to dopamine, and these bodies, we know that these bodies tend to not really develop a calf, so their lower legs don't tend to really develop. We find these people can push through pain. Physical pain is a stimulant to push through because they're so responsive to dopamine. And we can do this through body measurements and how the different ratios apply to each other from the measurements that we take. So I guess the reason that I'm telling you this is you don't need to flounder around and wonder what is best for you, what newest trend is going to work for you when it comes to your health, when it comes to your weight, when it comes to controlling stress, when it comes to controlling inflammation, all of that sort of thing. You don't need to wonder. There is a code, there is a manual of you and how you work best, how your body systems work best. And it's specific to you. As I said, I discovered it 2.5 years ago, and I've been gradually implementing and moving back all the unhelpful things I had that had become habit in my life. And so, to that end, I just wanted to share I'm going to be away for the next week because I'm taking it to the next level. I'm going for an immersive experience in living as the way my body was designed as part of a course. And I really want to talk about walking the talk. I mean, often people will say that, I'm very worried about my health, I'm worried about this, I'm worried about that, I'm worried about my weight, etc. But you can tell by their actions that there's a disconnect. So someone who's I'm worried about my breathing, for example, and the number of times I cared for patients who were worried about, they'd get extremely anxious that they can't breathe, yet they continue to smoke. And they knew that it was the smoking that was causing the issues. So there was a bit of a disconnect there. And that comes down to personal values. One of my personal values is health. And so this immersive experience that I'm going on is certainly it's certainly not $2 worth. It's costly, but I believe in it, and I believe in what we're doing, and I believe that it will make me a better practitioner, and it will also help my health. So I just wanted to encourage you to really have a look at whether health is something that's important to you, and no judgment here. Everyone has different values, and even if we do share the same values, how that plays out for us in our lives is different. So I just wanted to share with you, A, I'm going to be away next week, and B, have a think about if health, i.e. decreasing stress, having a healthy weight, having great energy, is something that's really important to you. What are you prepared to do to achieve that? So on that, I'm going to leave you. I'm going to wish you well, and I will see you back in 2 weeks. I hope everything goes well for you, and happy Mental Health Day. Bye for now.